My name is Jamil, and you're listening to the Public Health World podcast. Join me as I interview people in the world of public health, human rights, social justice, and controversial social health issues. Sit back, listen, and enjoy the podcast. This podcast was recorded on Kaurna country. I would like to pay respects to the Kaurna people, past, present, and future. I would also like to acknowledge that this land always was and always will be Kaurna land. I would like to pay my respects and acknowledge any other First Nations people listening in Kaurna country or around the world. Okay, guys, I made a bit of a mistake with my podcast earlier today. I was meant to have an interview with someone, but I got the time mixed up. So we're creating the first Public Health in 5, I guess. So here we go. So this episode of Public Health in 5 will be, first of all, the debut of this, but I decided to focus more around school and things like that for the first one. So considering I've just finished my first year of university, I thought I'd do a podcast on the 5 best tips for students, especially public health students, in this day and age, in my opinion. So we're going to go from number 5 being helpful to number 1 being the best thing, in my opinion, you can do. As I said, keep in mind this is all my opinion, and in some cases, some of my tips, my opinions won't necessarily help you or even be useful for you, so just keep that in mind. But yeah, so here we go. So number 5 is attend face-to-face classes where possible. So a lot of what I'm going to talk about is around networking and things like that, but face-to-face, I think you miss out on a lot of the connections that you would make if you were doing it any other way. If you're studying even hybrid, at least you get that ability to meet people and talk to them outside of an online setting. And I think that's really helpful because currently the world is not solely based online. As much as we wish it was, face-to-face interaction is needed a lot of the time still. So, yeah, I think attend face-to-face classes where possible. So, number 4 is to utilize scholarships and other support available at your university. Most universities have options of scholarships physically in the school. I myself was lucky enough to get a $5,000 scholarship, which was part of that I spent on my new podcast kit. But as I said, there's other options as well, but I think it's really cool to have that option and that ability to have a scholarships like that, and most universities do. Outside of that, there's also most universities now have mental health support on site. Doctors, in my case, we have a full doctor's, we're 2 minutes from the medical centre, but we also have a GP on site. We have mental health services. We have a student association which has financial counselling. We have disability support, and we also have other areas as well, like learning support. So utilize those supports. That's what they're there for. And I think attached to that as well is ask for help. If you are struggling with something, don't struggle with it. If you don't have to, ask for help. It's scary at first, but if you're struggling with something, ask. That's the worst they can say is no. Number 3 for me is join a club. Once again, it goes back to that networking thing again. Networking, I think, is key in this day and age, and we need to learn how to communicate with people, whether that be, and especially find your own interests. Part of university has always been about, and college in America's case, is to find your interests, find your passions. So yeah, go and do all those different things. Try the fencing club or the rock climbing club or the, I don't know, mountain bike riding club or something less like Dungeons and Dragons. Who knows? You may love that sort of club, but part of it's networking, learning how to speak to people outside of your own niche friend group that you had in a lot of cases, especially if you're studying in the same place as you went to high school. You might be with those same friends. Meet more people. It's good for you. Number 2, don't fixate on grades. A lot of people hate me for saying this, and I can understand it. But generally speaking, unless you're actually doing something that requires you to have a high GPA, so maybe going into medical school afterwards or other areas similar, generally speaking, the vast majority of people at university do not need to go and fixate the hell out of their grades. The fact is, as long as you're passing, you will get your piece of paper at the end. Yes, if you want to go further on and harder and everything like that, go ahead. But it's not a be all end all like it is in high school. And in that sense, also learn how to study properly. This idea of memorizing stuff doesn't work and shouldn't work. Start looking at alternative ways of study, but also learn how to kind of do it in a better way, in a way that is healthy for you. And the last one I've mentioned several times but haven't actually said, but learn how to network. In most health jobs, and especially public health, part of your job is learning how to communicate with a variety of different people on any given day. You might be working in government, in policy, and you might have to converse with stakeholders who are politicians, but you've also got to converse with the people on the ground, the lower SES community that you might be trying to help. You can't do that if you don't know how to network and you don't know how to talk and utilize those skills. That's the biggest thing in university. I think that's the most important thing out of anything you can take away from what I've just said, is learn how to network. The quicker you learn how to network, the better it's going to be for you. The better it's going to be in the long run as well. These skills are so transferable, whether it be if you're speaking at a seminar or, as I said, talking to stakeholders or other people in the community that you're trying to get on board with an idea. You can't do that if you don't know how to network, if you don't know how to do all that sort of stuff. So, yeah, I hope you enjoyed my first episode of Public Health in 5. It's a bit longer than 5 minutes, I understand, but that will hopefully get better over time. Thank you for listening, and tune in for the next one, hopefully with the actual guest and not me. Thank you for listening.